causes harm only to your throat and your lungs, does it even affect the oral cavity? Hi everyone, welcome back to my channel. So, do you think smoking is something which causes only harm to your lungs and your throat? Does it affect the oral cavity? Are there any changes that happen in your oral cavity because of the smoking? Yes, smoking causes a lot of harm to the oral tissues. Nicotine in any form is not good for you, and it's not good at all for your oral cavity tissues. So let me take up one by one what are the problems that can happen because of smoking. So if you are a chronic smoker, you must have noticed that the first change which you will notice is the staining of your tooth surfaces. The smoking, the nicotine which is present in the smoke or in your cigarettes, they are the ones which actually cause the staining on your tooth surfaces. There are tiny little pores on the tooth surface where these particles get embedded, and then they are very difficult to remove. With a regular cleaning, most of the time we are not able to remove the stains which are caused because of tobacco. So the tobacco or nicotine which is present in that, in whichever form, is not good for you. The stained teeth, as you all know, does not look good. Imagine that you're smiling and you see all brownish discoloration of your tooth, and that which cannot be even removed by a dentist at certain point of time. We need to do a lot of polishing and the using of certain abrasives in a higher way so that it can be cleaned. And a chronic smoker, there have been patients where the cleaning is just not possible. We need to do bleaching, which cannot be done on a regular basis. It is not good for your teeth. Along with that, if you notice, after a very long time, you can also notice changes on your lips which have lost the actual pinkish discoloration which is supposed to be there. The gums, they also turn pale pink over a period of time. So this is the first problem, which as aesthetically is what is going to be a concern for you. The second thing is, there can be loss of taste and smell sensation if you are a chronic smoker. The third thing would be a bad breath. The nicotine and the tobacco, the smell that is there, and if you are a chronic smoker, it is going to cause bad breath, not just because of the smell of the tobacco, but also because it leads to dry mouth. The heat that is produced because of smoking and the use of tobacco, on a long run, it can cause condition called as a dry mouth, and because of dry mouth, in turn, there can be problems because of that. Like, I will be doing a separate video on dry mouth and the problems associated. So in a brief way, if I would like to say, it would be like it can cause more amount of decay because the saliva is less and the cleansing action will be less. Because of the less cleansing action, there will be more amount of plaque and tartar buildup, which will cause your gums to have problems. The gums will start receding. There will be a lot of plaque and calculus accumulation. There will be bad breath, not just because of the smoke of the tobacco, but also because of other bacteria being flourished inside the oral cavity. So altogether, it's a bad thing for you. The next important thing is smoking can cause gum diseases. Now, how does that happen? Gums, they are filled with blood vessels, and that's how the gums they are going to stay strong, and they are being pink because of the large blood supply which is present there. So when you're a chronic smoker, what happens is that the blood supply to the gums will start reducing. Also, the WBCs, which are the most active cells which are present in not only in the mouth, in the entire body, which are going to fight against the bacteria, the number of WBCs are going to reduce. So altogether, your gums are going to become weaker. They are going to first start changing the color. From bright pink, they are going to change to pale pink. And also, this WBC loss and something, there are things which you cannot even see with your naked eye. And the change of color in the gums also, you may not notice. So what happens is, for a patient who is a smoker, even for a dentist, for us to identify that there is a problem, there is underlying problem, will be a difficult thing. Like, for example, the first and the foremost sign when there is a gum disease is that the gums get inflamed and there is bleeding on probing. That is, with slight provocation, the gums will start bleeding. That's the first indication of a gum disease, which will be absent in case of a chronic smoker because the blood supply itself is less. So when you go and provoke the area, there is no bleeding that is happening. So we assume that there is no problem, but actually there will be an underlying problem which is actually going on slowly. It is taking up, and by the time we realize, the gums would have already become weakened. There would be gum recession, and Finally, the treatment that can be done in a very simpler way becomes more expensive and more extensive for you. Plus, the gum health would have already deteriorated where we will not be able to do anything after that. So, the identification of a gum disease becomes very difficult in case of a chronic smoker. So, this reduced blood circulation along with the lowering of the immunity because of the reduced number of WBCs which are going to be present there, and you know that oral cavity is filled with a lot of bacteria. So indirectly your gums are going to become more prone for all the infectious diseases that can happen because of these bacteria, and you will never even know that there is something like this undergoing there. Even your dentist may not be able to identify that in the beginning. And the most important risk associated with smoking is oral cancer. Like throat and lung cancer, oral cancer can also happen because of chronic smoking. I'm not saying that every patient who does smoking will end up with oral cancer, but there is a very high possibility. The chances of them getting increases by almost 90% when they are smokers. And the self-diagnosis in this case is very minimal. There can be certain changes which can be seen in the oral cavity, which actually we term as a precancerous conditions or precancerous lesions, which can be seen in the mouth. But for diagnosing it by the patient, it becomes very difficult. There might be some redness or some sort of whitish areas which are present, which will be ignored by the patient. So an oral cancer stands a very high risk in case of a chronic smoker. The nicotine, tobacco and the heat all together in the oral cavity, along with certain other ingredients which are present in the smoke or the material that you're using, will be harmful because it causes certain changes in the environment of the oral cavity. The entire balance is lost. Thereby, what happens is that the cells start changing. They start showing certain changes in a microscopic level, which will turn into a cancer in a long run. Also, most of the tobacco contains some sweetening agents which actually are not good for your teeth, can lead to you will be more susceptible for having dental decay as well. So, if you are a chronic smoker, please do have a visit to your dentist on a timely basis, maybe once in 6 months. Do have a visit, get a checkup done for your gums, get a cleaning done. But after all these, the best thing that you can do is just stop smoking. I know nicotine addiction is very much real and it is very difficult. But if you know all these are the problems that you are going to get because of this, then I think, isn't it better that you stop smoking? That is going to help you in your long life than having a small amount of nicotine and having that little bit of pleasure which you get at that point of time when you are smoking. Start valuing yourself, reduce the amount of expenses that you're going to give because of smoking, the problems that you're going to have, and then the expense that you're going to spend on that. Value yourself, just stop smoking. Thank you.